The automatic doors swished open, letting in the faint smell of antiseptic and the muted chaos of a Friday evening ER. The waiting room buzzed with low murmurs, the occasional cough, and the distant wail of a siren outside. She stepped in, badge clipped neatly to her scrub top, hair tucked under a standard cap, mask covering the lower half of her face. Her posture was straight, her pace unhurried, but purposeful. Every movement was precise, controlled. Staff barely looked up. A nurse passed by, clipboard in hand, muttering something under her breath about a new hire. Doctors nodded curtly, too focused on charts to acknowledge her. She carried a small tote of medical supplies, arranging them meticulously as she made her way to the central nurse station. Her presence was almost invisible, until a tray of instruments teetered on the counter, threatening to spill. Without a word, she stepped forward, steadying it with a single hand. The small act drew a glance from a nearby orderly, who nodded, almost embarrassed, and returned to his duties. No one else reacted. To them, she was competent, yes, but nothing extraordinary. Just careful, quiet. She began her rounds. A patient groaned softly in a curtained bay. She checked his vitals with the calm efficiency of someone used to high-pressure environments. Her fingers pressed lightly, but with certainty, on the thermometer, the blood pressure cuff. Her eyes scanned the monitors, read the subtle color changes in skin and eyes, noticed the faint tremor in a hand. She noted the details silently in her pad. The patient relaxed under her touch, his body instinctively responding to the steadiness she exuded. At the end of the bay, a doctor barked a quick question to a colleague, glancing briefly in her direction. She answered promptly, her tone neutral, almost reserved, offering solutions without lingering on explanation. The doctor nodded, satisfied, then moved on, barely acknowledging her presence. A sudden squeak of wheels on linoleum drew her attention. A gurney loaded with an elderly patient jolted as it turned a corner. The orderly steering it stumbled. She intercepted instinctively, steadying the gurney with minimal effort, her body shifting in a way that absorbed the motion. The patient's blanket remained in place, no monitors dislodged, no alarm triggered. Only then did a nurse glance at her, a flicker of recognition in the corner of her eye before she quickly returned to the paperwork. She moved with a quiet rhythm through the ER. Every task completed, vitals, notes, instrument checks, was done with exacting precision. Nothing flashy. Nothing to draw attention. Yet, for those who paused and observed, there was an unmistakable awareness in her eyes, a calm readiness that suggested she was accustomed to situations far beyond what the ER presented. Minutes passed. Phones rang, patients groaned, monitors beeped. She continued her silent work. A trainee nurse fumbled a line of tubing, and she leaned over, adjusting it smoothly with a hand that carried no hesitation. The young nurse blinked, startled by the competence, but said nothing. Her reputation here, if it existed at all, was already beginning to take shape, not through words, but through the small, decisive actions no one else noticed. A tension lingered in the air, subtle but tangible, as if the ER itself recognized the shift she brought. She remained calm, unobtrusive, yet completely in command of the immediate environment. Nobody would have guessed that the quiet, precise movements of this new hire hinted at a depth of training and authority that far exceeded the hospital walls. For now, she moved in silence, carrying her secrets as easily as the supplies in her tote, fully aware that the real test would arrive long before anyone had a chance to notice her. Her shift had begun. And the ER was about to discover, the hard way, that they had misjudged her entirely. The ER settled into its frenetic rhythm, but beneath the usual cadence, small disruptions began to ripple through the ward. A patient's oxygen levels dipped unexpectedly. Monitors beeped, low but insistent, and a nurse froze, unsure which alarm to prioritize. The new hire was already there, hands moving swiftly, but without haste. She adjusted the mask, checked the tubing, recalibrated the settings. Everything returned to stability in moments. The staff glanced at each other, exchanging puzzled looks. They called it luck. She knew better. A tray of medication toppled in another bay, bottles clattering across the counter. A young orderly rushed forward, panicked. She intercepted, catching each vial with quiet precision, arranging them back in order without spilling a drop. No words, just movements that conveyed competence without needing recognition. The staff murmured appreciatively, but quickly turned back to their own duties. No one stopped to consider how her body seemed to anticipate the chaos before it happened. Lunch came and went. She ate alone, quietly observing. The ER was full of noise, pagers, phones, shouting, the occasional scream from a patient. She noted the patterns, the way doctors and nurses moved, where bottlenecks occurred, how minor errors multiplied under pressure. Every observation was mental preparation, training in situ. To anyone watching, she was simply methodical. To herself, she was mapping the ward, preparing for the inevitable. Then came the first real test. A patient, mid-age, wheeled in from a car accident, conscious but semi-coherent. His injuries were serious, internal bleeding likely. One of the junior nurses froze, unsure how to prioritize. The new hire stepped forward. Her instructions were simple, calm, almost imperceptible: stabilize vitals first, alert imaging, prep 4 lines. She guided the panicked staff with subtle nods and hand gestures. Everyone followed, almost instinctively, as though she were the conductor of the room. Her hands worked with quiet authority. She felt the tremor in the patient's pulse, noted the shallow rise and fall of his chest, and adjusted the fore-drip with a finesse that belied her title. For a moment, the ER seemed to slow down around her, the chaos contained within the calm of her decisions. Staff whispered afterward, calling it a good save, but they didn't fully register the skill behind it. Later, an equipment malfunction revealed another layer of her competence. A defibrillator failed to charge properly. Panic rippled through the team. She knelt, inspecting the device, checking connections, all while directing someone else to prepare a manual alternative. Within seconds, she had diagnosed the problem and corrected it. Staff glanced at her, this time a little longer, unsure whether to question their own assumptions about the new hire. Through the shift, small moments kept stacking. A door jammed, a monitor alarmed incorrectly, a patient veered off the bed, each challenge intercepted without fanfare. Her competence was evident not through loud displays or authority grabs, but through the quiet assurance of her presence. By the end of the day, a subtle shift had occurred. The staff were beginning to notice. The nervous orderly looked to her first when a stretcher rattled. The young nurse copied her technique rather than asking for instructions. Recognition was creeping in, silent and unspoken, but still incomplete. They had yet to understand that what they saw was only a fraction of her experience, that the depth of her training was far beyond anything in the hospital. As she prepared to leave, she paused briefly at the nurse station, watching the ward. Everyone was absorbed in their tasks, oblivious to the quiet assessment she had conducted. She adjusted her mask and pack, already anticipating tomorrow's shift. The early signs had revealed themselves: she was no ordinary nurse, and the ER would soon be forced to acknowledge it. And yet, for now, she walked out into the hallway like any other staff member, quiet, understated, perfectly ordinary in appearance. The seeds of doubt had been planted. The test was coming. The emergency doors burst open with a force that made the whole ER vibrate. A stretcher rolled in, flanked by 2 paramedics, and the smell of blood and antiseptic hit everyone at once. The patient, a man in military fatigues, was unconscious, his uniform soaked, torn, and caked with dirt. His injuries were severe: a gaping wound across his torso, a pulse that wavered dangerously, and shallow, uneven breathing. The staff froze for a heartbeat. There was a tension in the air they hadn't felt before. The attending doctor barked orders, but his voice wavered slightly. He had handled critical trauma cases before, yet something about this patient demanded more than routine attention. The new hire, the quiet nurse no one had truly noticed until now, stepped forward. Her hands were steady, her movements controlled. She adjusted the gurney, checked monitors, and quickly assessed the patient's vitals. The paramedics hesitated, almost expecting her to defer to the doctor. But she didn't. Her eyes scanned the monitors, then the room, calculating the most efficient sequence of interventions. The staff began to act, following her guidance without hesitation. She directed one nurse to set up a rapid 4-line, another to prep the crash cart. Every movement was deliberate, measured. She moved around the patient with a kind of internal rhythm that kept the room from descending into chaos, as though she had done this countless times under far worse circumstances. A sudden complication arose, the patient's blood pressure plummeted. The monitor beeped a warning, harsh and insistent. One of the younger nurses panicked, fumbling with the medications. The new hire stepped closer, her voice calm and low, guiding the nurse's hands. She administered the drug herself, checking calculations instinctively. Within moments, the blood pressure stabilized. A few staff exchanged glances, whispering under their breath. They couldn't explain how someone so quiet had regained control so effortlessly. Outside, the sounds of emergency vehicles were constant: sirens, boots on pavement, hurried shouts. Inside, the ER had become a controlled storm, centered on this single patient. A ventilator alarmed. The staff hesitated, unsure of the settings. She crouched, quickly adjusting the parameters, monitoring oxygen saturation, and scanning for any internal complications. Every movement precise, efficient, necessary. Minutes passed like hours. The injured man groaned, half-conscious, struggling against the straps of the gurney. One paramedic tried to reassure him, but his voice faltered. The nurse spoke softly, almost imperceptibly, checking his airway, stabilizing his head. He calmed slightly, instinctively trusting her authority without understanding why. The attending doctor took a step back. His initial commands had been tentative, now he watched her, silently measuring her competence. It was evident she knew exactly what she was doing, and she wasn't showing off. There was no need. Every instruction she gave, every hand movement, was precise and unyielding. The room flowed around her, following her lead without her ever asserting it verbally. A monitor beeped again, another complication, internal bleeding worsening. She called for surgical prep, giving short, clipped instructions. She caught mistakes before they happened: IVs placed incorrectly, lines crossed, medications misread. Staff were now following her instinctively, her authority growing with every small, decisive action. Time slowed. The ER's usual chatter had vanished, replaced by the tense rhythm of controlled urgency. Every staff member was aware of her presence, the quiet force steering the room. Yet no one knew her background, only that she was methodical, precise, and somehow unshakable under pressure. As the patient stabilized temporarily, the new hire stepped back for a moment, scanning the room. Eyes met hers, subtle acknowledgement passing without words. They still didn't know who she was, but they were beginning to sense that she was not what she appeared. The new nurse, they had dismissed as quiet, inexperienced, inconspicuous, had already taken command of the situation through action alone. Outside the curtained bay, a young nurse whispered to a colleague, barely audible, "She's different." No one corrected her. No one needed to. The quiet authority had already taken root. The crisis was only beginning. They had a critically injured ranger in their care, and every second from this point on would matter. The ER, unprepared for the severity of the case, had unwittingly handed control to someone whose true skills remained hidden. And in the corner of the room, she worked with the calm intensity of someone who had faced far worse. The staff were about to learn, in the hardest way, that they had underestimated her entirely. The patient's blood pressure dropped again, this time more sharply, and the monitors screamed with urgency. The attending doctor rushed to the bedside, his hands trembling slightly as he assessed the vitals. Nurses fumbled, unsure of which interventions to prioritize. For the first time, the chaos of the ER felt uncontainable. The new hire stepped closer, her movements measured, deliberate. She didn't shout or command, she didn't need to. Her eyes scanned the patient, the monitors, the staff. Every decision she made was calculated, precise, and intentional. She placed a hand lightly on the patient's arm, checking the pulse, noting the rhythm, pressure, and temperature. She adjusted the 4-line, instructed a nurse to prep the crash cart, and simultaneously monitored the oxygen saturation. One of the younger nurses hesitated with the intubation kit. Her fingers brushed over the tubing, guiding the nurse's hands almost imperceptibly. The nurse's panic began to subside. In minutes, the line was in place, ventilation effective, the patient stabilizing slightly. A quiet nod passed between them, a recognition of competence unspoken. The attending doctor, normally the authority in the room, stepped back, watching. He barked a suggestion, but she had already anticipated the step. With a subtle adjustment of the patient's head and a flick of her wrist, she aligned the airway, correcting what the doctor hadn't even realized was mismanaged. For the first time, it was obvious, the authority in the room had shifted, though no one spoke it aloud. Another complication arose. The patient's wound dressing had partially dislodged during transport, and bleeding began again. The paramedics had stabilized him before arrival, but the extent of the internal damage was worsening. She grabbed sterile supplies, her movements calm and efficient, and redressed the wound while directing a nurse to prepare for blood transfusion. Each instruction was short, precise, and necessary. No wasted words, no hesitation. The ER seemed to move around her, every motion influenced by her presence. She anticipated mistakes before they occurred, a nurse about to administer the wrong dosage of pain medication, a technician about to disconnect a monitoring line, each intercepted with quiet authority. She did not scold or demand. She simply corrected, guided, and maintained control. Minutes stretched as the patient's vitals fluctuated dangerously. One of the paramedics, frustrated, muttered under his breath, "We need more hands." She didn't respond verbally. Instead, she reorganized the room, delegating tasks with gestures and eye contact. Each staff member fell into place, their panic dissipating under the weight of her competence. Her focus never wavered from the patient. She monitored every line, every monitor, every subtle cue. Sweat formed at the corners of her eyes, but her movements remained fluid. A nurse attempted to stabilize the leg with a splint but fumbled. She reached over, positioning it correctly with a single, quiet movement. No applause, no acknowledgement, just effectiveness. Then the patient twitched, a sudden sharp pain causing him to grimace. The young nurse froze. She moved immediately, adjusting the sedation protocol with exact timing. She checked the oxygen mask, the foredrip, the wound pressure. Within moments, the patient settled again. The staff exchanged glances, realizing something they hadn't before. The quiet nurse was not just competent, she was decisive in ways that exceeded their understanding. For a fleeting second, time seemed suspended. Everyone in the room recognized her presence as authority, yet no one could explain why. Her calm, deliberate actions had taken the chaos of the ER and bent it to order without a word of command. The attending doctor finally stepped aside, silent, allowing her to lead the interventions. No one questioned it. They simply followed. She had won control, not through overt assertion, but through quiet mastery and competence under pressure. By the end of the shift's first major crisis, the patient's vitals were more stable, his injuries partially controlled. The ER staff, previously dismissive, had begun to shift in perception. The new hire they had ignored or overlooked was now the anchor of the room. And yet, no one knew the full story. Her authority was still a shadow, a quiet force that suggested experience far beyond the hospital. The staff would come to realize, in the moments ahead, that this nurse was not merely skilled, she had trained for situations far more dangerous, far more complex, and far more lethal than any ordinary ER could present. The first confrontation was over. The test had begun. The calm of the ER had been shattered, but the patient's temporary stabilization offered only a fragile reprieve. Monitors continued to beep warnings sporadically, reflecting internal complications that required more than standard protocol. The attending doctor and staff, now fully aware of the gravity, followed the quiet nurse's lead, but this time, the challenge demanded something beyond routine procedures. A sudden drop in oxygen saturation sent alarms blaring. The patient's chest rose and fell unevenly, each breath shallow and weak. A young nurse hesitated, glancing to the attending for instructions. The new hire assessed the situation with a sweeping glance, quickly noting subtle indicators, minor shifts in skin color, a faint irregularity in pulse, and a barely perceptible crepitation in the lungs. Her eyes narrowed, calculating, moving faster than the chaos around her. Instead of calling for standard intubation, she decided on a precise modification, adjusting the ventilator settings while repositioning the patient to optimize airflow. Her hands moved swiftly but deliberately, coordinating with a nurse she barely knew. Each motion was purposeful, no wasted steps, no panicked fumbling. The patient's oxygen levels responded immediately. Staff looked on, a mixture of relief and disbelief flickering across their faces. The trauma from earlier arrival had revealed another complication, a hidden arterial bleed. She noticed the subtle bruising spreading along the torso, its position masked by the wound dressing. Without hesitation, she instructed the attending to prep surgical clamps, guiding the team to isolate the problem while maintaining other critical interventions. Her voice remained calm, low, authoritative without raising volume. Staff obeyed instinctively. As the team moved, the ER itself became a stage for her expertise. She anticipated the needs of each staff member, who would need blood next, which lines could be adjusted to avoid duplication, how to clear the monitors of false alarms to maintain focus. Every movement was preemptive, every instruction exact. No one argued. No one doubted. Her authority was unquestioned, yet unspoken. The patient's pulse spiked suddenly, triggering alarms that pierced the tension like gunfire. One of the nurses instinctively reached for adrenaline, unsure of timing. She intercepted, adjusting dosage and administering it in tandem with a precise sequence of 4 fluids. The combination worked seamlessly, and the vitals began to stabilize again. During the same sequence, the paramedics assisting voiced concern over the ranger's mobility. A critical ligament injury threatened movement in the leg, complicating preparation for imaging. She positioned the leg manually, aligning it to avoid further damage, all while supervising ongoing interventions elsewhere. Staff watched her hands move with uncanny precision, realizing that she could manage multiple crises simultaneously, something no ordinary nurse could achieve. An unforeseen complication arose when the suction device malfunctioned. Panic threatened to creep back into the room. Without hesitation, she grabbed a manual alternative, instructing another nurse to keep the airway clear while she stabilized the patient's head and adjusted the line. The transition was seamless, no alarms triggered, no additional strain on staff. Minutes felt like hours. Every decision, every adjustment, carried weight. She calculated the best possible sequence of interventions, constantly scanning the room for unseen risks. When an error threatened, a misread monitor, a misplaced line, she intercepted without drawing attention or assigning blame. Her authority was quiet but absolute. By the end of the tactical shift, the patient was stable enough for imaging, though still critical. The ER staff, previously unsure of themselves, moved like a team under her guidance. For the first time, their doubts about the new hire were replaced by something else, recognition, tentative and silent, that they had underestimated her completely. Even as the crisis ebbed slightly, she did not relax. She remained vigilant, monitoring vitals, ensuring nothing was overlooked. Every action reflected her training, her discipline, and her ability to operate under extreme pressure without needing acknowledgement. The subtle authority she exercised was a warning. The worst had not yet come, and the staff would soon realize that they were in the hands of someone who had survived, and led, in far deadlier circumstances than any hospital could provide. Her quiet command had shifted the ER from reactive chaos to controlled order. And while the staff followed her lead, none yet knew why her competence felt so innate, so practiced. They would soon find out, but not yet. The ER, momentarily controlled, began to unravel again. Another patient arrived, a middle-aged man with multiple injuries from a nearby industrial accident. His condition was serious but less immediately critical than the Rangers. Still, his arrival added layers of complexity, testing the limits of the team. The monitors in the Rangers' bay began to alarm intermittently, signaling a subtle decline. Staff glanced nervously at each other, uncertainty creeping back. The new hire moved between the two critical patients effortlessly, reading each situation at a glance. She recalibrated ventilator settings for one while directing the other's airway management, never pausing, never flinching. Her body language exuded calm authority, her eyes scanned constantly, catching every nuance, every potential error. A sudden equipment failure threatened to derail the sequence. The suction machine in the Rangers' bay jammed mid-procedure. A nurse froze. She didn't speak, she reached, assessed, and improvised a manual solution. Lines were cleared, monitors checked, the airway stabilized, all in seconds. Staff had begun to trust her instinctively, moving under her guidance without explicit instruction. The industrial accident patient's condition worsened unexpectedly. Internal bleeding caused his blood pressure to plummet. The attending doctor looked overwhelmed, orders spilling out in a rushed, disorganized stream. She intercepted, silently redirecting the team. For lines were switched, fluids administered in calculated sequence, and vital interventions completed with minimal motion and maximum efficiency. The room obeyed her rhythm, not his. A junior nurse panicked, about to administer a double dose of a sedative. She caught the nurse's hands mid-motion, redirecting with a gentle but firm touch. There was no scolding, only correction, and the nurse obeyed, almost without thinking. Staff began to notice something different. This quiet nurse didn't just manage the patient, she managed the room. Meanwhile, the Rangers' injuries complicated imaging. X-ray and CT machines were occupied, technicians hesitant to move the critical patient. She directed the sequence with minimal words, adjusting his position manually to ensure safety, coordinating with the technician to maintain continuous monitoring. Each movement minimized risk, each instruction reinforced her authority silently. As tensions rose, a nurse accidentally knocked over a tray of instruments. Normally, it would cause panic, but she caught the fall before it even became an issue, setting the tools back into place, hands steady, body angled to absorb the motion. The staff around her began to notice the difference. Her competence was consistent, precise, and intuitive. A subtle moral tension emerged as she assessed both patients. Choices had to be made, how to prioritize interventions without causing harm to either. She calculated risks rapidly, balancing the lives in front of her. Her decisions were not about ego or recognition, they were about restraint, control, and the quiet execution of duty. Minutes passed like hours. Each complication compounded, yet she moved through them with the same calm authority she had displayed from the beginning. Staff were beginning to rely on her instinctively, deferring to her judgment even when they had higher titles. The air in the ER shifted, her presence was no longer invisible. By the end of the escalation, both patients were stable, barely, but alive. Staff exchanged glances, some hesitating to speak, realizing they had misjudged her entirely. She hadn't shouted orders. She hadn't made grand gestures. She had simply moved, acted, and led. The subtle power in her restraint, the way she calculated, corrected, and prioritized, left the room changed. Recognition, though unspoken, lingered in the eyes of the staff. They knew now that the new hire was not ordinary. And yet, she remained in the background, as quiet as she had been upon arrival. No congratulations, no verbal acknowledgement, just her continued focus on the monitors, the vitals, and the slow, steady rhythm of the ER. She had managed escalation, controlled chaos, and established authority, not through spectacle, but through quiet mastery. The staff's understanding of who they were dealing with was growing, but the true measure of her experience, training, and resolve remained hidden, like a shadow just beyond reach. The night was far from over, and the hardest decisions were yet to come. The ER was quieter now, but the tension remained thick, a low hum beneath the fluorescent lights. Both the ranger and the industrial accident patient were stable for the moment, yet each complication reminded the staff of how close they had come to losing control. The nurse moved between the two bays, scanning monitors, assessing subtle changes. Every second counted. A critical decision emerged: the ranger's internal injuries were worsening faster than anticipated. Surgery was required immediately, but the team assigned to him was stretched thin. The new hire could act alone to stabilize him long enough, but it meant exposing herself directly to a procedure far beyond standard nursing scope. There was risk, every action carried consequences. She paused for a heartbeat, eyes on the monitors, weighing outcomes. She could continue delegating, letting the attending doctor make the call, keeping herself safely in the background. But doing so might cost precious minutes, reducing the ranger's chances. She made the choice silently, decisively. Her hands moved, steady and precise, guiding a small team through the interventions herself. Every motion was calculated, every instruction delivered with economy. The room felt heavier as she worked. A nurse glanced at her, noticing the intensity in her eyes, the discipline in her posture. The decision she had made was not about recognition, it was about life. She corrected a misplaced line, administered fluids at exact timing, stabilized the airway, all while monitoring vitals and anticipating the effects of each action. A sudden shift in blood pressure alarmed the monitors again. Staff hesitated, but she had already moved, adjusting sedation and aligning the patient's body to optimize circulation. One nurse whispered a question about technique, and she responded with a subtle demonstration rather than words. The staff absorbed it, understanding through observation rather than explanation. Moral tension lingered as she realized her choice carried another cost: her own fatigue. Hours of sustained focus, minute adjustments, and rapid problem-solving left her drained, yet she did not falter. The decision to intervene directly had been made with restraint, not recklessness. Every motion preserved life while minimizing unnecessary risk. The industrial accident patient required attention simultaneously. She directed a nurse to maintain stability, monitoring remotely while her focus remained on the ranger. Delegation was precise, controlled, and anticipatory. No one questioned her judgment, her authority was assumed, earned through action. At one point, she glanced briefly at the attending doctor, who watched silently, awe creeping into his expression. But she did not seek acknowledgement. Recognition was irrelevant. Her choice had been purely moral and tactical, to intervene directly and ensure the survival of the critically injured patient. Minutes dragged. Every alarm, every twitch of the ranger's body demanded immediate, measured response. She adjusted medication, shifted lines, and read subtle physiological cues that others missed. Each decision carried risk, yet she executed with controlled precision. Staff could only watch, learning in real time what competence looked like under pressure. When the ranger finally began to stabilize, a quiet shift occurred in the room. The staff's previous doubts had vanished. They understood, without words, that the new hire had made a choice that defined both authority and morality in the same gesture: life over safety, duty over recognition. She stepped back slightly, monitoring the scene but allowing the team to continue under her subtle direction. No one cheered. No one acknowledged her explicitly. The moral choice had been made, consequences absorbed, authority implied rather than declared. Her eyes flicked briefly to the ranger, unconscious but alive. He had survived, in part because of her intervention. The staff had learned an unspoken lesson: competence and courage could be silent, yet absolute. And she remained quietly in the background, as she had arrived, her presence commanding respect without needing acknowledgement. The ER had survived another wave of chaos, but the true weight of the night, both physical and moral, was still settling. She had paid a cost unseen, assumed a burden unspoken, and reinforced the quiet authority that no one had yet fully grasped. The night had deepened, but the ER was far from calm. The ranger's vitals, though improving, remained precarious. Every monitor, every drip, every subtle change in skin color or pulse was a warning. One misstep now could undo all the progress they had achieved. The quiet nurse stood at the center of it, moving with a rhythm that commanded the room without a word. A sudden complication struck. The ranger's blood pressure dropped sharply, more severe than before. The attending doctor and nurses reacted instinctively, but hesitation crept into their actions. She stepped forward immediately, her eyes scanning the monitors, reading vital signs, and mentally calculating the precise sequence of interventions. She coordinated without speaking above a low, calm tone. For bolus, now. Maintain airway. Pressure dressing, tighten. Her instructions were sparse but exacting, delivered with authority that left no room for question. Staff moved with her guidance, hands following gestures and nods rather than shouted commands. As she administered fluids and adjusted sedation, another complication arose: the ranger's wound dressing had shifted, and hidden bleeding was seeping again. A nurse reached for the clamps, uncertain of placement. She moved closer, hands steady, correcting the alignment with minimal motion, repositioning the patient to optimize pressure. Each adjustment was both surgical and precise. Her mind raced silently, prioritizing: stabilize circulation first, then address bleeding, monitor oxygen, prepare for imaging if necessary. She anticipated mistakes before they happened, intercepting a misread monitor, correcting a misconnected line, preventing the chain reaction of errors that would have been inevitable under ordinary circumstances. The staff were aware of her control, yet no one spoke it aloud. They followed, almost instinctively, recognizing the competence behind every gesture. Her calmness in the face of cascading crises had shifted the authority of the room entirely. The attending doctor, once the commanding presence, now acted as a support, providing what was asked rather than dictating action. The ranger's pulse faltered again, sharp and uneven. She reached for the crash cart, but instead of following the standard sequence, she adapted, improvising a technique tailored to the patient's specific injuries. She guided the team through each step, timing interventions with a precision that was almost imperceptible. Every decision was deliberate, restrained, and exacting. During the procedure, a junior nurse made a subtle error, misplacing a line in the tension of urgency. She corrected it immediately, hands steady, without scolding or drawing attention. The nurse nodded silently, understanding more in that moment than she could have from hours of instruction. The quiet nurse's authority was now fully established, inferred through competence rather than claimed verbally. The room seemed to contract around her focus. Monitors beeped, alarms echoed, and the ER's chaos pressed against the edges of control, yet she remained the anchor. Her eyes flicked to each staff member, scanning, adjusting, intervening only when necessary, maintaining order without the need for loud assertion. Minutes felt like lifetimes. She administered blood transfusions, managed sedation, adjusted oxygen, and monitored the ranger's internal response simultaneously. The staff had fallen into a rhythm under her guidance, moving as if anticipating her thoughts. Every mistake was intercepted, every complication addressed, every second accounted for. Finally, after what felt like endless minutes, the patient's vitals stabilized. Heart rate steady, oxygen adequate, bleeding controlled. She stepped back slightly, allowing the staff to continue monitoring, but her presence still dominated the space. The attending doctor exhaled, a faint nod of acknowledgement passing silently, though she did not return it. Recognition had been earned, but she did not claim it. The injured ranger, unconscious, shifted slightly. In a rare moment, he gave the faintest nod, an unconscious acknowledgement that this was the hands keeping him alive. It was subtle, almost invisible, but it carried more weight than any verbal praise could. She moved through the ER, checking monitors, confirming 4 lines, adjusting minor equipment issues. The young nurses and technicians watched, no longer uncertain, no longer dismissive. Their perception had changed entirely, though no one spoke it aloud. They now understood, through observation and outcome alone, that this quiet nurse had operated at a level far beyond ordinary training. Even in the aftermath, she did not linger in the spotlight. She collected her supplies, confirmed the patient's stabilization, and prepared to step away. Her authority had been fully demonstrated, yet subtly, the recognition from staff was muted, almost involuntary, a quiet acknowledgement rather than a celebration. The ER was alive with activity, yet her presence remained singular, controlled, unshakable. Every motion, every decision, every quiet correction had reinforced the truth the staff had resisted accepting: she was not simply a nurse. She was trained, disciplined, and capable of commanding situations that none of them could fully comprehend. And just as silently as she had taken control, she allowed the room to resume its rhythm, leaving no trace of ego or exhibition, only the weight of competence and quiet authority. The final confrontation had been won, not with spectacle or dramatic heroics, but through restraint, decisiveness, and calculated mastery. She had saved the patient, guided the staff, and revealed, indirectly, the depth of her true capability. The ER would never forget the night, though most would not fully understand it. The quiet nurse had spoken without words. She had led without claiming praise. And the injured ranger, somewhere between consciousness and unconsciousness, had nodded in respect, an acknowledgement both subtle and absolute. The chaos of the night gradually eased. The alarms quieted, the monitors steadied, and the rush of patients slowed to the usual hum of the ER. Staff moved with a tentative calm, their earlier panic replaced by a quiet awareness of what had just occurred. The injured ranger remained stable, still unconscious, his breathing even. The industrial accident patient had been transferred for imaging, his condition secure. The team worked efficiently, but there was a subtle tension in the air, an unspoken acknowledgement that the night had been controlled by someone far beyond their expectations. The quiet nurse moved through the ward methodically, checking monitors, adjusting 4 lines, and confirming supplies. No one asked her to. No one acknowledged her. And yet, everyone watched her, a mixture of relief, curiosity, and respect passing silently between glances. They had witnessed her command, her competence, her authority, but she claimed none of it. The attending doctor stopped briefly at the nurse station, glancing at her with something close to awe. He opened his mouth to speak but thought better of it. Words were unnecessary. Her actions had spoken more clearly than any explanation could. The young nurses who had initially doubted her followed her example instinctively, quietly absorbing her methods without discussion. In the corner, the orderly who had tripped over the gurney earlier paused, noticing the subtle corrections she had made, the quiet decisions that had prevented catastrophe. He shook his head slightly, silently recognizing that he had underestimated her. She did not linger. She methodically logged notes, confirmed the patient's statuses, and prepared to leave the ER. Every movement was precise, deliberate, controlled. No one called her back. No one tried to commend her. The acknowledgement was in glances, in quiet understanding, in the subtle nods exchanged among the staff. As she stepped toward the exit, she glanced once at the ranger, still unconscious. There was no overt recognition, no dramatic gesture, only the faint trace of respect in the curve of his brow, unconscious yet present. It was enough. The ER returned to its routine. Patients arrived and departed, alarms rang and faded, and staff moved through their shifts with the usual efficiency. But the memory of the night lingered, the night when control had been taken silently, decisively, by someone no one had expected. The quiet nurse remained in the background, as she had arrived, unseen but fully present. Her authority had been established, her competence undeniable, yet she had avoided the spotlight entirely. The staff knew they had been wrong to dismiss her. They did not speak it aloud, but the recognition was there, unspoken and enduring. The ward settled into a rhythm once more, but the balance had shifted subtly. The presence of the quiet nurse had changed everything. She had demonstrated control, discipline, and moral judgment, all without drawing attention to herself. And in that subtlety lay the weight of her authority, acknowledged, respected, and unspoken. The ER lights hummed overhead, casting a pale glow across the now calm ward. The patient beds were orderly, monitors steady, and staff moved with quiet efficiency, their earlier tension softened but not forgotten. The night had tested them all, and though no one voiced it, every glance carried a silent acknowledgement of the nurse who had guided them through the storm. She moved along the aisles, checking lines, adjusting monitors, confirming vitals. Each motion was deliberate, precise, and calm. No one interrupted. No one called her attention. She did not seek it. The quiet competence she had demonstrated hours ago continued, invisible in its subtleness, yet foundational to the continued stability of the ward. The ranger, stable now, lay unconscious but alive. Nearby, the staff paused briefly at the bed, their eyes flicking to her almost instinctively. A subtle nod passed between one of the paramedics and a young nurse. Recognition had been granted without ceremony, quiet and unspoken, mirroring the manner in which she had led all night. She collected her supplies, checking that nothing was left unattended, that every line, every monitor, every patient care detail was correct. She adjusted a blanket here, a pillow there, making small, precise corrections that prevented potential discomfort or complications. Each gesture was careful, restrained, and authoritative, yet unseen as anything extraordinary. A nurse lingered by the station, watching her. "She knows exactly what she's doing," they whispered softly, more to themselves than anyone else. No one challenged the statement. It was the truth, and they understood it without needing to say more. She stepped toward the exit, shoulders straight, steps measured. The ER had returned to its rhythm, but nothing was the same. Staff moved differently, their awareness subtly altered by the night's events. The quiet nurse had reshaped the environment, not through recognition or words, but through actions and restraint. As she passed the ranger's bed, she glanced briefly, her eyes meeting his in a fleeting, almost imperceptible nod. No words were exchanged. No outward acknowledgement was demanded or offered. The respect was mutual, quiet, earned. The ward settled into normalcy, the night ending not with fanfare, but with subtle balance restored. She disappeared into the hallway, unseen, yet her presence lingered, an unspoken authority now woven into the rhythm of the ER. The staff had learned a lesson without ceremony: true competence does not demand attention. True leadership does not need recognition. And those who underestimated her had been proven wrong, silently, completely, and irrevocably. The quiet nurse left the ward as she had entered, unnoticed, uncelebrated, but undeniably present. The night belonged to no one, yet it had been guided by her hands, her judgment, and her quiet command. The ER continued. The world moved on. And she remained, as always, quietly in control.